Gun violence has been at the top of our minds for several weeks now. And more than 31 people, including 19 children, were killed in the month of May because of mass shootings.
So our 9 Health expert, Dr. Payal Kohli, is with us today to talk about a tough subject, gun violence, and the impact on our community. So from a medical standpoint, the violence epidemic, what do you see?
You know, Tom, I'm so glad you called it an epidemic, because it really is an epidemic that's been raging on for years. And now that we've lived through the COVID pandemic, we sort of know what an epidemic means, which is something that affects a large proportion of people in a disproportionate fashion. In 2016, the American Medical Association called it a public health crisis. And yet, here we are, 6 years later, have made very little progress. So I think it's a time for the medical community to wake up, for our individual community to wake up and start to take some action to change these trajectories.
And you know, we've talked a lot about being a safe gun owner and locking your guns and making sure children aren't around them and everything like that. But this mass shooting is a different level. And without getting into the whole political area, oftentimes though, mental health comes up, specifically when they talk about the shooter.
Not often, Kim, I would say almost every time, they blame mental health as the reason for this to happen. And I would say that is, if you look at the entire pie, a very small piece, if at all. Because some shooters, there's no prior mental health diagnosis. About half of them don't have any. But even if mental health was a small piece of the pie, that's not entirely everything. Because if you look across the world, mental health problems across other countries, just as much as here in the United States, perhaps even more if they're underdiagnosed and undertreated. Yet we have the most gun violence of anyone. And if you look at the number of guns per American, there's 323 million Americans, and there's 400 million guns, 98% owned by civilians. So mental health may be a small piece, but it's really the access, the implementation, and the public health infrastructure.
But someone who commits a mass shooting clearly has mental health issues, that they're willing to take many lives. There are mental health issues. But you're saying that broad brush, in some ways, cheapens the way people view mental health in reality?
Very much so. It discounts the mental health problems that people are really struggling with. And the American Psychiatric Association has actually profiled shooters. And what they've seen is that they're very different. And there's 3 aspects to it. One is biological, mental health problems, psychotic disorders, family history. But the other 2 are psychological and social. So social means you feel isolated from others. That's your support network. And then psychological is your perception of yourself. You could have, you know, low self-esteem, low confidence. So mental health is just a small piece of it.
Many people feel that and don't act in such a manner. Many people struggle with those issues, but they don't find themselves with a gun or threatening to kill many people.
That's exactly right. And there are some people whose mass shootings may be motivated by hatred, racial issues, bigotry, what have you. It doesn't necessarily have to be mental health. And by blaming mental health, I think we're doing ourselves a disservice by not actually identifying and diagnosing the true problems.
I think everyone gets pushed towards action. What do we do as a community, as an individual? What do you do?
So what do we do with the COVID pandemic or epidemic? Diagnosis, prevention, and treatment. So first is diagnosing the problem, understanding it, recognizing that it's there and addressing it, finding the flaws. Second is prevention, and that's where we as individuals, I think, can really contribute. We can talk to our kids about gun safety. We can, you know, really try to educate each other about how to be safe with guns, and the medical community can do that as well. And then the third is treatment, and that's where you really want to think about access, limiting access as a way to really control the way that this has evolved.
It's hard to, you know, put numbers on prevention and the things that don't happen, but we have to get to that place.
You know, and it's crazy because the #1 cause of death in our kids now has become firearm-related injuries for the first time ever. It has crossed motor vehicle accidents, cancer, infectious disease.
And those other things that you mentioned are things that people become very active in preventing and superseding and heading off. And this is one that will hopefully follow that same track where that prevention that you talk about does come to pass. From a medical standpoint, thanks for visiting us, Dr. Payal Kohli, today.
Thank you.